See this guy do me. See this guy do me. I'm about police today.
Make you calm down. What is this? You don't need to calm down. I don't like call police. Give me my phone. You get blood. Give me my phone. Please. Call police.
It's so unfortunate that what could be prevented by doing just a simple first aid technique. But before I explain that technique to you, let's look at the cause of death. Now go and get a pen, go and get paper, so you learn. Talking about the cause of death, if you look at that video, you will see where the cut was made, just a little below the elbow joint. That's to tell you that the brachial artery or the radial artery has been cut. And how do you know it's an artery? The blood is usually bright red and also it pumps out profusely. Bear in mind that arteries are the ones that carry blood down to all organs in the body under high pressure of 120 mm mercury. So when it's being cut, you're going to bleed out within minutes. To be precise, 3 minutes. You might wonder, how does one bleed out within 3 minutes? Now take your hand closer to your chest. You feel your heartbeat. Now in each heartbeat, the heart pumps about 5 tablespoons of blood, which is equivalent to 73.9 mils of blood per beat. And in a normal human being, the normal resting heart rate or heartbeat of a human being is 60 to 100 beats per minute. So if you do the math, you find out that the heart pumps about 4,434 mils to 7,390 mils of blood per minute. If you convert that to liters, that's about 4 to 7 liters of blood being pumped by the heart in a minute. Now the next question is this: how many liters of blood do you have in the human body? In a normal human body, we have over 4 to 6 liters of blood. Now remember I told you that the heart pumps this blood within a pressure of 120 mm mercury, right? Now the next question you ask me is this: how fast does the blood move? How fast could you take a red blood cell to move from the heart around the body then comes back to the heart? The answer is simple. It takes a red blood cell to move 3 feet per second. That is, it takes a red blood cell less than a minute, 45 seconds to be precise, to move around the body from the heart down to the organs and back to the heart. So what am I saying? In that pressure of 120 mm mercury, in a minute, it's about 5 liters of blood going around the body and returning back to the heart. So you can see why death was imminent in that case, because in a minute it takes 5 liters of blood to go around the body. Yes, you're not going to bleed out all the blood in your body and everything, but when bleeding becomes life-threatening is when you lose about 50% of the blood. And as it starts to bleed out, what happened? Within minutes, hemorrhagic shock sets in. Blood supply to many organs in the body are being limited, and as they are being limited, remember, they begin to tire. Red blood cell carries oxygen, so when there's less oxygen supply to some of the organs, they begin to shut down within minutes. Know this for a fact that when an artery is involved, within a minute the person is losing maximum blood. Now what do you do as a first aid treatment? One thing you should not do is rushing the person to the hospital without first stopping the bleeding. And how do you stop the bleeding? Do you know? It's by tying a tourniquet, not doing videos or pictures about the person or the victim. Tie a tourniquet simply means tying a constriction just above the injury or the site of the cut. Now always remember that when you are tying a tourniquet, you tie a tourniquet the space between the injury and the heart. So for example, in that video where you have the cut here, where you're going to tie the tourniquet is just the space within here and the heart, which is here. You're going to tie the tourniquet here. Remember, don't tie the tourniquet over a joint because you're not securing the bleeding. Another mistake you might make while tying the tourniquet is tying it over the wound. No, you tie it a little bit above the wound. For example, as I showed you, when the cut is here, just tie it above the wound, always above. If the cut is right here, when you're tying the tourniquet, you tie it above the wound. And since an artery is involved, you have to tie it so tight that you stop the bleeding at that initial time. And the next thing is, try to get some help. Take the person to the hospital, or if you're a place where you can access the hospital, dial the emergency services immediately. And you only have the right to tie a tourniquet, but you don't have the right to untie it. The only person that has the right to untie it is a doctor, a medical doctor, under a controlled condition. And with this technique, you should have made it alive at least to the hospital. That is why it's called first aid, first help. That should be the first help you should give them. The first help should not be your phone to take pictures or videos.